This episode of Wellness with Delaney is sponsored by Zen Principle. We all know the feeling. It's 10 a.m. and that first cup of coffee is starting to wear off. Cue the crashing energy levels and total lack of focus. So you find yourself reaching for a second cup just to take the edge off. And then around mid-afternoon, you start to feel that same familiar crash coming on. So you reach for your third. And then suddenly you realize you are stuck in a doom cycle of chugging more and more coffee just to make it through the day until you're on edge, jittery, and wishing there was a better way. Me personally, yeah, I've been there. But I recently found a solution that not only gives me that burst of energy that I so badly want, but it actually supports all day energy and focus without the crash and without the jitters. Meet Zentelligence Ultra Focus Nootropic Supplement. This comprehensive 8-in-1 formula supports cognitive function through multiple pathways, targeting focus, memory, energy, and mood support. Featuring powerhouse nootropics like organic lion's mane, alpine galangal extract, acetylcholine, ginkgo biloba, water hyssop, L-theanine, and caffeine from green coffee bean extract. This supplement right here is a simple but powerful way to battle daily brain fog in the short term while also working in the long term to support the longevity of your cognitive health. So where a cup of coffee might give you a burst of energy for 2 hours followed by that horrible dreaded crash, Zentelligence provides up to 5 whole hours of balanced and focused energy completely crash and jitter free. As a busy health and wellness coach, content creator, and podcaster, I just don't have time to feel exhausted. So Zentelligence Ultra Focus Nootropic Supplement has everything I need for better energy, helping me maximize my productivity, but most importantly, doing so naturally and without anything artificial or shady. As a very holistic ingredients freak, this is something that I actually feel good about. And here's the deal. Unlike so many other supplements out there, Zentelligence is research-backed, using very clearly disclosed dosages for optimal transparency, and it's made in the USA in a GMP certified facility, which is basically a fancy way of saying it undergoes the highest level of scrutiny and standards to make sure you're actually getting the highest quality ingredients and benefits. So what the heck are you waiting for? Break up with that afternoon crash and shop Zentelligence using Delaney for 15% off. The link is in my show notes, so make sure to check it out and start giving your brain what it really wants. Welcome back to Wellness with Delaney. Today I have Rachael Austin. She is the head of education at the Thompson Method, which is a really just groundbreaking and incredible method around lactation and breastfeeding. She is a midwife. She's also a board certified lactation consultant. So total wealth of knowledge. We are going to get into all the different tips and tricks for lactation, for breastfeeding, why women are struggling so much with that nowadays, and what your rights truly are as an expectant mother. Even if you don't have kids right now, this is a great episode because what I'm learning as someone who's pregnant is that the best time to prepare is before you're in the moment. So that's my goal. I hope that's your goal as well. Rachael, thank you so much for coming on today.
That's my pleasure, Delaney. Thank you for having me.
Yeah, would you mind telling me a little bit about your background, how you even got into the world of lactation and just educating moms?
Look, it's something that I'm just passionate about, and I've always just really loved it. But I'm a registered nurse, a midwife. I'm an endorsed midwife, a child and family health nurse, an IBCLC. I have a master's in advanced clinical midwifery, a graduate certificate in health professions education, and other qualifications and things as well. I originally went into home birth practice, and I met Robin probably about 25 years ago. And she was my beautiful mentor into practice. And I did that for a good long while. And then I've worked rurally in other places as well. But really breastfeeding was the part that I've loved the most. And probably the part I think most women really struggle with. And it's the conflicting, confusing advice. It's overwhelming. Their expectations don't meet what they learn prenatally. And it becomes so overwhelming, and we know most women want to breastfeed, but don't or can't. Anyway, I had a beautiful phone call from Robin one day when I was at the end of my tether in another job that I was doing. And she said, I've got a job position for you to be head of education. And I was like, yes. So I've been here working with Thompson Method for the last 6 years doing this amazing work. And no day is the same. I'm working in leadership, in management. I'm working in education. I'm teaching our practitioners, our educators. I'm working with women. So I have clients on every continent. of the world, which is just phenomenal. And, I'm in research. I'm doing some research now. I'm doing my honours degree at the moment. So I think I have a good grasp on everything that's kind of happening. Maybe not specialised, but I have a good knowledge of what's going on. Yeah.
Wow, such a wide background of education. I love that as well. I feel like, you've had your hands in so many, from the really holistic to the conventional, kind of seen this from all angles. And something that I am seeing and hearing and reading a lot, one thing I'm very nerdy, so I'll like read every birth story. I just got through, I'm reading like Ina May's Guide to Childbirth, and it's like hundreds of birth stories. I just got through all of those. Like, I love this stuff. But I'm hearing a lot of women are like, they go in to labor with the expectation of breastfeeding, and then when they struggle at first, especially if they give birth in a hospital, they're kind of pushed formula, right? And so they're like, okay, and they'll do that. And I think that there's kind of an encouragement to give up before really trying in some cases, not in every case. What would you say to these women who maybe struggle at first and feel like, okay, well, maybe breastfeeding's not for me?
Well, let's go back a step, because breastfeeding doesn't start with the birth of a baby. It starts when you fall pregnant. And when you enter into a system, and I've been using this language lately because I think it's really resonates with a lot of women. When we find out we're pregnant, we're on a stick and we get the confirmation and we go to the doctor, and then we're told we need an early dating ultrasound because, what would you know about your body and your cycle, and we need the technology to tell us when you're due. And then we're groomed into medicalization. So it's around the expected due date, which becomes a deadline. So, then if women have any other, we're risked out of childbirth. So, so many women today are induced, and it starts with we'll just give you a little strip and stretch. And it goes from there. So it's, they break the waters, you're induced. It's the whole cascade of intervention. But it's so much more than just the cascade. We have insurance companies telling midwives, obstetricians, how they can practice. It's the hospital policy, so medicalization, institutionalization, all of these things are controlling women and how they give birth. So when we go through all of these interventions, we've given birth, whether that be vaginal, whether you've had an epidural, ventouse, forceps, whether you've had cesarean, however that is. Most women in the hospital system start off breastfeeding on the back foot because the cord is clamped early, the babies are drug affected, they're separated early at birth, there's routine early weighing, needles, whatever. All of that in time efficiency, and it's an institution that allows for in, through and out, not just establishing breastfeeding. So often those first 3 golden hours, so in the hospital they talk about the golden hour. For most women that's just not enough. Babies have had drugs in labour birth, epidurals are extremely common. Babies are sleepy, they can't coordinate oral function. We know oxytocin, artificial oxytocin, affects breastfeeding. So it takes babies much longer to establish early breastfeeding. But if we can have them skin to skin, unhurried, unrushed, no coercion, no fear, and they can start to use neurosensory survival skills. But what happens in the system, they start jamming babies on breasts. So they start holding them by the back of the head, hamburgering the breast and trying to jam them on. Trying to get them to do this, so nipple to nose. No mammal in the world feeds like that, but that's how breastfeeding is taught all over the world. And this is why women have problems. Babies are going, oh my God, no. You see them resisting, and they're communicating. They don't understand what's happening. So we force them harder. Babies develop an oral aversion. They don't feel safe at the breast. Women very quickly develop pain and trauma. Then there's the fear of not enough milk, so we start to introduce formula. So even though it's behind locked doors, there's now a need and an urgency, so we give formula. But we don't just give little bits of formula, it's a calculation. So we give 150 mils a kilo a day. which is massive. Colostrum is tiny little low volumes of milk, tiny little dots. So now the babies are full on formula. They sleep longer. Now we wake them to feed them. They're not hungry because they're still full of formula. So, it's that whole cascade of intervention, and it just continues and continues. And that's not how breastfeeding looks like. None of this is what is good management of breastfeeding. And I don't talk about lactation. Lactation is medicalized. Women, mothers breastfeed. We don't sit there and talk about lactation. We sit there and talk about how we breastfeed.
Yeah. No, I'm so glad you brought up that this starts long before the baby's actually born. Because, I've been learning, I actually just released an episode with a doula who works kind of in like the radical birth arena. And, we talked a lot about these interventions, and I don't think people actually realize what an induction means and what synthetic oxytocin does to the brain specifically and like to the body, because you hear oxytocin, we're going to put you on oxytocin. You think, okay, it's the same thing my body's producing, and it's not. And even just giving baby autonomy, I think that just the whole birth system is pretty messed up. And I'm so glad that medicalized birth is there for emergencies, for true emergencies. Yeah, but then I really do take issue with the fact that healthy pregnancies, low-risk pregnancies, and low-risk births are treated like a sickness or a medical emergency versus an age-old physiological just process that women have been doing since the beginning of time. And I think that is a huge problem at the core of it. So I totally agree with you there.
It is. And if we look at the data today, PTSD, postnatal depression, postnatal anxiety is huge because of the hospital system messing up how pregnancy, labour, birth, breastfeeding should unfold. And sadly, the leading cause of death in new mothers today is suicide. And we don't talk about that enough. It's kind of hidden under the covers. All around the world at the moment are birth trauma inquiries. I know Australia's had one, the UK has one, the US I think always has one because the system is so messed up.
Yeah.
It's revolting. What are we doing to brand new mums? There should be a wonderful time.
Yeah, absolutely.
But I would encourage mothers to, as first-time mums like yourself, Delaney, to do prenatal breastfeeding education and learn about the transitions from pregnancy, labour, birth into breastfeeding, and learn how to navigate the system, how to ask questions. Ask what, if you don't know what you don't know, so you have to learn that information. If things don't go to plan, how do you navigate that? Have that information so that one, you know what to do in the moment, and two, have a team around you that you know that you can access for help.
Yeah. So what are the best resources for women out there? Like, how can women who are pregnant, like myself, learn how to breastfeed or just get prepared for that ahead of time? Like, what's out there that's available to women?
Yeah. So Thompson Method is an amazing resource. We have clients all over the world. We have two options for pregnancy information. So first of all, we have the self-directed online program, which is the birth and breastfeeding program. The pregnancy section is about 4 hours in length, so it's not too much. It's quite reasonable for most women to do that. And then you go on into the breastfeeding section. Now, the second part is a lot of women wanted to have someone basically hold their hand and take them through the learning. So what we have is we offer the beautiful breastfeeding program, and our breastfeeding educators, who are often doulas, childbirth educators, they may not fit our criteria to be a practitioner, and they can take you through. So they can do that online, in small groups, one-on-one, however works. It's a very flexible program, and I really love that. It's social and it's interactive, and it's a lot of fun. So I really enjoy that. Following on from there, people can access our practitioners as well. So like myself, we're a registered healthcare professional, and we have pre-birth chats. So for women who have had a traumatic time, like them could be for anything, but a traumatic time before or had difficulty before and wanting to debrief that. Or women who have had their baby, they've been through the system, they're having difficulty, and we would do a breastfeeding rescue together online, and that's amazing as well. And a lot of people probably have fears that seeing things online isn't the same as in person. Actually, my experience is very much the opposite. We're expert at doing this online, and I can see everything that I need to see. And for those women that have had a traumatic experience through the hospital, could be at home, but it's very rarely at home, usually in the hospital, I can't touch you. And that's a real, and not that I'm ever going to touch you anyway, because no one should touch the mother or her breastfeeding baby or at all. But there's a safety net there for women. So, if they wanted to, they could just hang up the call. Not that anybody has ever done that to me, but, there is that safety net as well.
That's
Following
beautiful.
on from that, we have the club. We've got Care and Connect calls. I run these beautiful Care and Connect calls every day. So I'm often in the neonatal intensive care, the special care, the hospital ward. I'm at home, talking with partners, grandmothers, siblings, best friends, whoever the woman's support network around her is. We just involve everybody. So it's social, it's fun, and it's supposed to center the woman.
I love that so much. And then, so for you, when you're doing a consultation and you're looking at, so I'm assuming you watch the breastfeeding process, it sounds like, and can kind of guide. So what would you say? Because I've heard, like, for some women, if they get like a shallow latch, and I could be botching this because I'm still really very at the beginning of learning this. And they talk about it being painful or different things like that, right? Or not getting enough milk out. However, like, what are some of the common mistakes that you're seeing women make off the bat when it comes to breastfeeding?
Most hospitals, unless they've learnt the Thompson Method, are still practicing outdated techniques, latching techniques. Newborn and young babies, mammals, do not latch. It's like pizzas are delivered, babies aren't. The garden gate latches. Babies do not feed like this and jam them on. Imagine if I jammed you into your plate.
Right.
You're not going to enjoy it very much. And you can't vacuum. So babies vacuum. They teach asymmetry. So babies need symmetry so they don't have pain. So and there's a lot to understand. If that's the breast and that's the nipple, that length of our thumb is roughly where the soft palate is. You can try it. Okay? If you take your nose off the nipple, see how the nipple comes forward?
Yeah.
Instantaneously. So when we're trying to do these nipple to nose, it goes directly where we want it, in the hard palate behind the nose. So you will get pain. There is no doubt that they will get pain, and it's shallow because babies can't vacuum. So what mammals do, the lips seal the breast, and as they come on, the vacuum pads, they start here, they engage. So the tongue curls around the nipple and intraoral vacuum pressure increases, and the nipple molds as it vacuums, and it goes in along the midline of the tongue and up into the soft palate where it's protected. And babies have unique oral cavities, and that's completely normal. We're all different, which is why in most cases it doesn't matter if babies have tongue, lip and cheek ties, high channel palates. All babies have a recessed chin. That's normal because we need the chin to indent the maternal breast, nostrils to touch the maternal breast, and both cheeks to touch. So people start pathologizing normal anatomy because they don't understand how breastfeeding works, and they're still teaching outdated techniques. When oral devices are introduced, such as nipple shields, they're regularly introduced. I don't have one on me, but what happens with wide-based bottles, nipple shields, this is what we would encourage when it's needed, narrow, long, and one hole. But the wide-based ones that with the short teeth, they say they're like the breast. Well, they're nothing like the breast. They don't have an oral function like the breast. But the best they can do is draw to the tip like that, because no way will that ever reach the soft palate. So that means the baby's reverting back to that and chewing with the tip of their tongue, and that's where women experience pain and trauma, and they're saying the latch is shallow. Yes, it is, but it's a change in oral function. They're reverting back to the shape of the devices, and it is causing pain. So we need to be really careful about introducing oral devices, and if we do need to, which ones we are, because nipple shields shouldn't never be used, really. They're not designed for breastfeeding. They were designed originally to collect samples of breast milk to that purpose, but they become a saleable item. But no one ever explains how they change oral function, and they're extremely hard to wean off.
Yeah, that makes sense. And then for things like pacifiers, do those also hinder breastfeeding?
Yeah, they do, and especially all the different shapes. There's so many different shapes, and they do. Babies will revert back. So you see the flat ones. Some have got like a lipstick shape. Imagine your nipple looking flat and compressed, or a lipstick shape, which means it's being compressed up here. Very painful. So, there's a time and place sometimes for the really unsettled baby, but hopefully that should only be very short-term use, and just as a soother and then take it out. But there would be special shapes that we would suggest to protect and preserve breastfeeding first and foremost.
Yeah, and I think I've decided, like for me, I'm like, I don't think I'm gonna do pacifiers at all. Granted, I'm very fortunate to be in a position where like my plan is basically to be in contact with baby 24/7 for
Yeah.
as long as possible. Like I don't feel like I'm in a position where I need anything to soothe.
Yeah.
And so that's a really big blessing that I know like I can't take for granted. But the more I learn and the more I learn about like oral development, palate, mouth breathing, breastfeeding, and like to me it just makes sense to not even introduce them. Because once
Yeah.
you introduce it, like you're kind of stuck, they're pretty
Well,
addictive.
well, yes. It's just another layer of problems, really.
Yeah.
In the first and early breastfeed, so before breast milk volume peaks, we are looking at frequent feeding because the baby's desperately working to bring in milk volume. It's extremely tiring for mums, especially come about day 2. There's a lag time so the babies are really hungry. They're feed, and this is the time when most women say, "Oh, I'm really tired. I don't have milk. Can I have formula?" Or midwives say, "Here's the formula." But actually the baby's doing really important work. So if we can just have mum rest when she can, feed as frequently as she can, then the milk comes in. And then the baby can have a good feed. And the stomach is only as big as it. That's my stomach.
Yeah.
So look at the baby's tiny little closed fist. That's roughly the size of their hand, their stomach.
Wow.
When breast milk volume peaks, this is when we need to gently space feeds. So they should be about 7 to 8 in 24 hours. So we aim for left breast, rest and digest, right breast. And then next feed it would be right breast, rest and digest, left breast. Then we even up. We have a small ratio from this breast and some from this breast. Next breast, most from the first, some from the second. And in this way, it helps to regulate breast milk volume, reduce the risk of engorgement block ducts mastitis. It helps to reduce gastrointestinal pain. There's a good break between feeds so mum can have rest, baby can rest. Baby needs to rest so it can put on weight. Newborn and young babies, once milk volume has peaked, don't frequently feed. So in the hospital, they often say at least 10 to 12 times. And often I'm hearing women feeding 18 plus times in 24 hours. And they're exhausted and their babies aren't putting on weight. So, it adds to the complexity. Actually, we don't need to have a full stomach all the time. Breast milk is perfect. It's uniquely adapted. And we just need to feed to cues of satisfaction. It's always baby-led. But they naturally feed about 7 to 8 times. Sometimes it's more, sometimes it's less. But roughly speaking, and that's really important so that mum isn't overwhelmed and completely exhausted and depleted if she's feeding. Imagine being up every 2 hours if you've just had a really long, arduous, traumatic birth. And now you're saying, here's a baby, go and feed every 2 hours, wake the baby to feed. It's exhausting, it's depleting. And often, if you've got a healthy baby, not recommended.
Yeah. Okay. So I have a few questions about this. I love this. So starting with, you mentioned like the left breast, rest and digest, right breast, kind of per each feeding. So are you pausing halfway through each feeding then essentially? And for how long would you be pausing then?
No mathematics. It's always
Okay.
listen to your baby. Your baby's communicating. So when we watch the cues from the first breast, babies feed to cues of satisfaction. So they often look really heavy, milk drunk. The eyes close down, the palms relax, the body relaxes. But when you're watching them, they seal and vacuum, they stimulate, so short and fast, and that releases the milk. Then they swallow that flow. You'll see them swallow, then they'll pause. The pausing's normal. Don't annoy them and try and, rouse them. Leave them be. And then they stimulate again. The next flow comes down and they swallow. And they might have maybe 3 or 4 flows, however much per breast. It's unique to every woman. And then you see the cues of satisfaction. So they start to look really milk drunk, heavy, relaxed. Then they start just to butterfly suck. Then they start to lose the vacuum and they often start to come up to the tip. And often, not always, but often you'll feel their bottom lip quiver and it feels like a brrr kind of feeling. And that's a nervous response from the stomach to the brain to the lips that they're full. So at about that time, you can gently take them off, or they might just come off themselves, whatever. Then you want to lay them out flat or put them up over your shoulder. We don't want to hold them by, the chin and double them up and pat them on the back, because then they're so short through here that you're kind of pushing everything back up and out and they'll vomit. So we don't want that. We want them to be long through their torso. So they might just stretch out and have a lovely sleep. And that milk starts to ferment, starts to digest. The gas is the byproduct of fermentation. This is where the burp comes from. Babies don't swallow air. And most people think that's really surprising, but you can't. Have a little drink of water there now, Delaney, and see how much air you swallow. None. It's a closed system. The lips seal the breast. We swallow milk. We breathe air. It's exchanged through the lungs. If we do have any bit of air, it's not in the way that people, think in their heads. I'm seeing these online memes where babies, this is how much air your baby swallows, a small balloon. No, there's no fact in that. We have to go back to Anatomy and Phys 101. So the gas starts to rise, ferment. Baby may start to open their eyes, wake up. The tongue will protrude the lip. They'll activate walking, crawling reflex, so hands, legs, bigger movements. The voice activates, and then they cry. So crying is a really late hunger cue. We can give them the second breast. So they have most from the first, some from the second. Remember how tiny the little tummy is. It's only tiny. So they don't need the big volumes like formula. Totally, totally different. So we have some from the second breast, go through the same things again, and then that's it. The feed is done. So however long they rest and digest, it's a vagus nerve response, and it's just about following baby's cues. They're communicating and we're listening and interpreting. So if you've seen that they're drinking really well and you're seeing those cues and they come off crying, that's more gastrointestinal pain rather than hunger.
And would that be related to like maybe what the mom's eating as well?
Not usually what they're eating, but I would suggest, so a lot of women are told to go on these restrictive diets. I don't believe in that. There is just no need for that. Okay. But I would suggest eating a wide variety of food. Food is medicine. Have a different breakfast every day, a different morning tea, a different lunch, a different dinner. Have a wide variety. Enjoy lots of good, healthy, nourishing food. Now, supplements that women are taking are causing loads of problems in the newborn and young baby. So unless women are specifically deficient as per blood test for the newborn and young baby, I don't suggest taking tablets. So that would include multivitamins, fish oils, probiotics, placenta capsules. They're really dangerous. A whole range of things that women take. Now, if women are deficient, say they're anemic from their last blood test, they may need an iron tablet. If you are low in vitamin D, it's not urgent or emergent, but you might like to take a vitamin D. But generally speaking, I would suggest working on food and diet.
Okay, gotcha.
But if women are having, say, a common denominator all the time, that could cause problems. Oats are an excellent example of that. Oats don't make breast milk. Hormones make breast milk. So these so-called galactagogues, they don't do anything. Hormones make breast milk, so prolactin and oxytocin. So, eating oats is fine, but if we eat them every day, often the babies develop oat belly and they become very unsettled.
I'm so glad you said that because a lot of women are eating like these oat cookies every day for lactation.
Oh,
And
they're
to
just
me,
marketing scam. Yeah,
yeah, to me, I'm like, there's so many chemicals in oats. I mean, even if they're not sprayed, like, don't even get me started on the glyphosate, but also like, the lectins, the phytates, all these things. I'm like, wait, I don't, it's not adding up. So I'm glad you mentioned that.
yeah. It's marketing scam, honestly.
Yeah, that makes total sense to me. I mean, I feel like women when they're trying to breastfeed and they're struggling, they're very vulnerable and it's a really great place for brands to make money. But I kind of want to backtrack
Yeah.
because this you mentioned placenta tablets and actually I have been going back and forth on whether I wanted to encapsulate my placenta because I hear really strong arguments on both ends. Okay, can you tell me a little bit more about this? Because I know a lot of people in my audience either have taken them or have considered taking them. So, and I know myself, like, I've been trying to learn as much as I can about this as well.
Yeah. So humans aren't designed to eat their own placentas. Other mammals do, but they eat it raw, not encapsulated. It's not a regulated practice and it's not an evidence-based practice. So for every argument that, is put forward, there's actually a very strong evidence-based counter argument. It doesn't prevent postnatal depression. In fact, it can enhance postnatal depression.
Really?
Yeah, there's so much. I see the mothers that are taking it, the babies are screaming, really unsettled. So look, there's a lot of reasons. The risk of contamination. No, the people who are drying them out and preparing them, they're all doing it in a different way, adding different herbs in, different things. So you don't know how much of anything that you're getting. And look, I could talk about it for ages, but I won't go on and on about it. But I don't recommend it. It's not an evidence-based practice, and according to all guidelines, it's not recommended.
This is really good to know because, I've really gone back and forth and I've been like, I've been just pulled. And so it's good to hear this from you, especially from like the lactation or from breastfeeding standpoint, because obviously like my biggest thing is wanting to do what's best for my baby. Like number one, right? But then I know with that, so some women they say like because of the hormone drop you experience after birth, they believe it like raises. So if this is not, if that's not the solution to like supplementing hormones, do you have any recommendations for women who might be struggling with that like post labor just hormone crash?
The hormone change after the placenta is born is normal and expected, and that's how we've evolved as human mammals for however many millions of years. So I think don't pathologize something
Mm,
that's totally normal. The hormones do change on day 3. We're often really, teary and we cry for no reason. That's really normal. Rather than pathologize it, embrace it. Have a
yeah.
nice cry. You might just feel like the load is lifted. Have people around you that are looking after you, so making you meals, making sure that you're well fed and tucked up in bed, the other kids are looked after, the house is clean, the animals are fed, or whatever that you need, Have people in your circle around you nurturing you. But it's not about giving you something else to take by mouth. That's just a whole nother realm of medicalization and pathologization. We don't need to do that. This is normal. So we need to look after you, feed you well, make sure that you've, not over drinking water, but you're drinking to thirst. That's really important.
Mm-hmm.
Sleep, rest. You've just gone through pregnancy, labor, birth. Your body needs to rest.
Yeah, I love this philosophy too, because I think it is so true that we do treat everything like a symptom that needs to be cured. And
Mm-hmm.
there are some things that might be indicative. Some symptoms are indicative of maybe a lack of health in an area of life, but some things are just part of life. I was actually just having this conversation with my husband, and he was, we have a lot of pregnant friends right now.
Sure.
And he was like, talking to everyone and seeing what they're going through, it seems like you're having a really easy pregnancy, right? And I was like, well, I wouldn't say easy because I think even the most dream pregnancy is still stretching you and challenging you really. It's changed me so much in the sense that it has stretched me beyond my limits and challenged me, and I feel like I've really evolved as a person in pregnancy. But I'll say it's challenging, but it's not hard. And I think that's the difference, where I'm like, yes, I think I'm having a great pregnancy. I really feel good, but I'm challenged. And I was like, the biggest thing I feel right now is just I'm really tired. But I don't think tired is a symptom that needs to be cured. I understand, especially right now in this moment when we're filming, like my baby's near the last week of a really, really rapid growth spurt. And so I'm like, being tired isn't some symptom I need to fix. I just need to go lay down, and honor that. And I think, and so I think I really resonate with what you just said, where it's not a symptom that needs to be cured necessarily, even though we've been taught to believe that. Sometimes it's like, no, just listen to your body, listen to your cues. And it's one thing if maybe there is something crazy going on, but if there's things that's normal, and I think also if you know what's going on and kind of educate yourself, like, because I know what's going on in my baby stage of development, I'm like, oh yeah, I'm extra tired because she's literally doubling in size right now. Like, that's okay. It's not a symptom.
Exactly.
Yeah. So I am curious too. So when you are feeding, so kind of going back to the process of feeding, I was watching on Instagram, my whole algorithm right now is like all things pregnancy and baby, of course. And someone was saying, so like after you feed them, I was seeing people post that you want to keep them upright for a little bit to digest so they don't choke. Like, is that true? What do you recommend for like positioning after feeding?
Whatever the baby wants. No, you don't have to be upright. So the stomach, into the stomach. So esophagus, esophagus, stomach. And so the milk will ferment in the stomach. The gas is the natural byproduct. The esophageal sphincter is it keeps the milk in the stomach. So when the stomach expands too far, so they're given too much milk, or it's really fermented. So women who take supplements, their babies have a lot of gas, lots of burps, lots of farts, and that's really like burping and farting is normal. Everybody does it, but they do cause a lot of gas, and for babies that causes a lot of discomfort. But often for first-time mums especially, they naturally have a high volume. That's just how we've evolved. It's really normal, and over about 6 weeks it tends to regulate if we're not interfering with that process. So as the milk is fermenting in the stomach, the stomach will naturally expand, and it's like a volcano under pressure. When it reaches that capacity, the esophageal sphincter will release, and they'll burp, or they'll posit, they'll vomit. That's the excess milk. So don't think you need to feed them again. But when they do that, it burns all the way up, often all the way down if they're refluxing, and then they want to instinctively suck. And this is what people do. They give them more and more and more. So they're in that cycle now, but they're actually refluxing and they're needing to suck. It's a neurosensory survival skill. But if babies, you don't need to burp a baby. In fact, you can't burp a baby. That process happens on its own. So to think that we can put a baby up over our shoulder and pat them on the back and we're patting the air out is ridiculous. We can't do that. We're soothing them. We're communicating with them. We're nurturing them. We're loving them. We're soothing them, all those things. But we're not patting the gas out.
Oh, this is the first time I've heard this. So is it still good to do that? But it's just, that's not like, it's not accomplishing what we think it's accomplishing?
You don't have to do anything. You can let them lay out over your lap and they can stretch out and be so long as they're stretched and long through here so the stomach has space, then that process will happen on their own. Now, it's different if they are crying or wriggling or they, having spasmodic pain or whatever, and they're asking to be picked up. Of course, pick them up. Let's communicate, respond.
Yeah.
That's really normal, but they will burp and fart on their own accord. You can't make them burp. And the same with farting. The gas will come down through the intestines and it will work its way all the way through, and then eventually they'll fart. And of course they often get some discomfort. We often call it colic pain, because as it works down, and women who take supplements, it's much worse. The babies really suffer with colic pain, and often it peaks 6 to 8 hours after we've consumed whatever supplement. So it often happens in the early evening, often when we're trying to cook dinner, and we call it witching hour, but it's usually related to something we've had 6 to 8 hours previously. And this is where the babies get fussy. They want to, frequently feed or cluster feed, but it's not because they're hungry. because newborn and young babies don't cluster feed. They not once milk volume is peaked. They do when they've got pain, and this is the problem, that they've got discomfort from often what we've eaten or consumed 6 to 8 hours previously. So that's another myth that people often believe, that the older baby will cluster feed to calorie load to sleep longer during the night, but not the newborn and young baby.
That is so interesting.
Yeah, age and stage is really important, but not everybody has the knowledge of from pregnancy through to the older child health years.
Yeah, absolutely. Yeah, I feel like I'm learning this all for the first time, especially being, the first daughter to get pregnant and all these things. I'm just learning so much. So then, I think that sometimes women, from what I'm seeing too a lot, is like anytime the baby's showing any sign of distress, oh, they're hungry, let's feed. And what I'm hearing is a lot of those cues might not actually be indicative of hunger. So what do common, like, actual hunger signals look like?
Well, usually they feed around about 7 to 8 times in 24 hours. So it's usually been, 2-3 hours, however long before the last feed. They open their eyes, they protrude their tongue, they activate walking, crawling reflex, they get bigger movements, they activate their voice, so you hear the noises, and then they cry. So crying is a really late hunger cue.
Mm-hmm.
They might have had a nice long sleep, they've woken up, and now they're starting to show those signs that they're hungry. And it depends on their personality. Some babies are really easy breezy, and nothing matters, they'll just do whatever. Other babies are more like, and they go from 0 to 100 in, a second flat. Yeah. So it depends on their personality, and we all have our own unique personality.
Yeah, that makes sense. I mean, I guess that's what mother's intuition is so real. And I even see that. I always joke with my husband. I'm like, sometimes I doubt myself and doubt, like, will I know my child to know these things? And he's like, Delaney, you can look at our dog and know exactly when she needs to poop. Like, I think you're fine. And I'm like, you're right. You just learn. Like, I think women are so in tune, and the way a woman's brain shifts in pregnancy to be really emotionally heightened. Like, we are literally designed to know our children. So sometimes I forget that too. And I'm like, I think it's just interesting going into a first time.
The problem is around breastfeeding mothering, we've now been imposed with so many rules. Yeah. Instead of just going back to how we have survived for millions and millions of years, we have communicated with our baby. We've listened. We're intuitive. We listen to our body, our breasts, what's happening. It's all connected. It's a partnership. But now we have so many rules. And the rules are there for insurance, for policy, for litigation management. They're not about you. They're not about safety. They're certainly not there to empower you and to help you along your journey. And like I hear so many women say, I've been told breast is best, I have to breastfeed, I go through the hospital system, nothing has geared me toward breastfeeding, and then they say, well, the first sign of trouble, here's the formula, now you've got to go home. And, all these rules, they're not conducive to good breastfeeding or successful breastfeeding.
Definitely. So from a nutritional standpoint, like, what are your thoughts on formula versus breast milk?
Well, there's no competition, is there? We know breast milk is a living fluid. It has hormones, microbiome. But I mean, again, I wrote a book on formula and self-published that quite a number of years ago now. Look, there's time and place for everything, and some women choose to use formula for various reasons, and that's their choice, and they should be supported and looked after to help feed their babies safely and nourish their babies. Most babies given formula will grow and thrive, especially in our first world countries. Really different in third world countries where we don't have access to clean water and things like that. In saying that, not all areas in first world countries have clean water either, and I know that's been a bit of a thing in Australia at the moment. In some of our Aboriginal communities who who literally town water is coming out black. So so safe water is really important. But of course breast milk is best, but for some medical reasons babies may need to be supplemented, or there's reasons for formula occasionally. But statistically, realistically, evolutionary, Most women can breastfeed without pain, without trauma, with no problems with milk volume. And realistically, women that do have problems with milk volume during pregnancy, that should be detected as to really, we should know that in pregnancy, and that should be spoken about in pregnancy. So you would have hormonal conditions or things that we would know as a midwife or a lactation consultant, and we would be talking to you about that, because we would see it on your pathology, we would see it on a breast exam and things like that. So unless, that's a whole another area of discussion.
Yeah. No, I think that's fascinating. Are there any simple, just off the top of your head, like any lab markers that might indicate more difficulty with breastfeeding?
So hormones make breast milk, prolactin and oxytocin. So if you've got hormonal or endocrine problems that potentially can affect your prolactin and oxytocin, and it's not definitive. Sometimes we have just to go, well, look, there is a possibility, but we're going to set you up for success. And some women are going to have no problems. Other women may have problems. So potentially polycystic ovary disease or PCOS, thyroid problems, potentially people with undiagnosed celiac disease whose bodies are really malnourished, iron deficiency, things like that. Then, of course, we've got, things that we can't predict, like retained placenta that may happen. It's interesting that, sometimes we do see retained placenta where they have thought the whole placenta has been removed, but actually there's still fragments, and that's holding the hormones back. And then once that's been removed, amazing, the milk comes in. Yeah.
That is so fascinating. Does that happen more when traction is applied, or can that also happen with natural placental delivery?
It can happen, but look, I always think when you interfere with the third stage of labour that it does increase the risk.
Yeah, I would imagine. I mean, my philosophy personally is like, as long as there's no emergency, I just want to let nature take its course. Like that is, I don't want anyone interfering. I don't want anyone telling me what to do. I have a midwife, but I'm like, we're going to keep it very, very basic, very primitive.
My general rule of thumb is no bleeding, no problem. And so long as there's no bleeding, there is no problem, there's no urgency, wrap mum up, keep her warm, keep baby warm, skin to skin, initiate breastfeeding as the baby's ready, and the placenta will come. But it's really different if there's bleeding. If there's bleeding that is urgent and that is emergent, and we do need to step in and do something.
Yeah, absolutely. That makes total sense. And that's where it's like, emergency interventions exist for a reason, and they can be life-saving. And so that's where it's like, it's hard, because I think people, when they hear my stance on things, they're like, oh, so you just, and I'm like, no, I'm not anti-medicine in emergencies. It's just, there's a natural way to do things. Exactly, when it's appropriate. So then, so with all the talk of oxytocin and how it impacts breast milk coming in, especially for new moms, if a mom, let's say she's feeling unsupported or struggling with her mental health, or maybe like has people around her in her home, in her space that like she really does not want to recover on, like she doesn't feel comfortable, could that like mental blockage inhibit the breast production or breast milk production and that flow?
You would have to be under extreme amounts of stress. Now, if you just look back through history, there's been multiple wars, separation. Go back literally to the beginning of time, where humans are a pretty violent sort of race. Women have always endured, and I know we've had community around us that have been able to step in and help out as well, which we really don't have as much anymore. But women are pretty tough.
Yeah. That's very true.
Yeah.
That's very true. Very resilient. I like that philosophy. Sometimes when I find myself getting stressed in pregnancy, then I stress about the fact that I'm stressed. You know what I'm saying? And I'm like, I'm not supposed to be stressed. So it's so funny though. I've never in my life been like stressed about the fact that I'm getting stressed. I'm like, this is not helping. I just need to just feel it and release it. Like, it's okay.
Yeah. And sometimes when you are just feeling that, go and have a walk, go and do some swimming or some yoga or whatever kind of just ground you again. Go for a walk out on the grass with no shoes on and just ground.
Yeah. Oh, I love that. Sometimes we really just do need to touch grass. And that can be said in a derogatory way, but it's also true. Like, it's sometimes like we all just need to go touch grass. Yeah. Absolutely. Yeah. That's why I'm so glad I'm due like late spring going into summer. I'm like, because we can actually just go sit outside in the sun.
And I often tell women that, just get out of the house, Go and
Mhm.
introduce the baby to the dog and the cat and the grass, and let them listen to the birds and the bird song
Yeah.
and, the wind, and all the babies love it.
Yeah.
And then they'll be tired, they've explored, they're, sensory, absorbing all the sensory, stimulation, and they'll be happily exhausted. They'll have a feed and they'll go to sleep.
Oh, I love
When
that. I love that so much. So then kind of, we've talked about like breast milk, we've talked about formula. What about like what's your thought on like pumping in bottles? Like is there a time and place for that in like a normal scenario?
um, some women do need to, especially women who are returning back to work. I don't like how it's promoted online in social media, where women have
Mhm.
massive, deep, the biggest deep
Yeah.
freezers full of breast milk. We just don't need that much milk. So if you're returning back to work, what I would generally suggest is just for a little bit of time before you go back, and she'll know, there's no math, um, add in one expressing session a day. So breastfeed as normal, halfway between, so your breasts have got time to refill, express, refill, breastfeed. So you would commit to that time, the same time every day, build it up over a few days, maintain it for a week or 2 weeks, however long, and then wean down off it. And that's it. You've got your little stash to get you started in case of
Mhm.
emergency. And when you're at work, you're expressing in sync with your baby's feeds. You literally have fresh milk for the next day, so it doesn't even need to touch the freezer. So
Mm,
then you're good.
yeah.
And that's it. Keep it really simple. What I am seeing though, is a lot of women using devices like the Harker or the Boon Trove. Literally, please do not buy these devices. Throw them in the bin if they are given to you. There is no time and place they are not pumps. They are extraction devices that use negative pressure to extract the milk out of the breast. In the very beginning, it creates high volume. So imagine the ductal network looks like a bunch of grapes coming down to the nipple. They're full, under pressure, high volume, fast flow, increases the risk of painful nipples, engorgement, blocked ducts, and mastitis. It does not treat mastitis. It creates mastitis. It increases the
Oh.
risk of mastitis. It does not capture the drips, as they say. It extracts the volume of breast milk in that breast. It leads to one-sided frequently feeding, which increases the risk of gastrointestinal pain. Mothers are exhausted, babies are exhausted, weight gain problems. Long-term use, because it doesn't stimulate hormone, leads to low breast milk volume. So if
Mm.
anyone listening gets one of these devices, please don't ever use it. Please literally throw it in the bin.
That is really good to know. Do you recommend doing like a more manual pump situation if you're going to do it?
Um, it depends on the woman and the
Hmm.
reason why. And
Yeah.
so women who may have a preterm baby or in the NICU, for example, I really like the manual pumps because they're really intuitive. You got the handle, and you're controlling the speed, the pressure, everything. It's very intuitive, and I really like that. But for some, the mum in the NICU who has to express around the clock, 7 to 8 times, in 24 hours, it may just be more efficient for her to be able to use a double electric pump, which is fine, but it's more around how you use the pump. We're
Hmm.
not power pumping. We're not treating ourselves like an old dairy cow that gets, it's
Yeah.
awful. It's
Yeah.
terrible. And we're extracting milk. We're not doing that. We're relaxing, we're simulating breastfeeding, what a baby would do under normal conditions. Hormones make and release breast milk. So it's how we use our breast pump is really important. Whether it's a single or double electrical, a manual or whatever. But we're definitely not using the suction devices like a Harker or Boon Trove. There's no place in breastfeeding for them.
Yeah. That is super good to know. Yeah, because I personally like I want to pretty much exclusively breastfeed and then maybe when she's a little older, like have the option for a bottle just to like go to Pilates, but not for a while, not for my goal is to really not do that for a while. And I know my husband's like, I want to feed her, but I'm like, well, that's the woman's special job.
It
But
is, and it actually creates a lot of work. So if
mhm.
you're getting up in the middle of the night to express, So not only are you awake now, you're expressing, and you're now having to clean a pump, and now you're cleaning bottles so dad can do the
Yeah.
feed. It actually doesn't help at all. It actually doubles the workload, quite literally.
Yeah. And from my standpoint, like, I feel like having a special bond, 'cause I think a lot of dads want that special bond, but a dad can never replace a mom carrying a baby in her womb for 9 months, delivering baby, like breastfeeding. That is like, I think that bond with dad grows, but there is also just like a very special, like unique bond between a mother and a baby. And I just think that's natural and is fine. And not to promote jealousy, like that grows. Like I hated everyone but my mom when I was little. And then I became like, I loved my dad once I was a little older. But
Of
that's
course.
just babies need their mom. But then the other thing with pumps that freaks me out lately, and I don't know if you've been seeing this or if this is something even you care about the way I do, but I have been seeing that there's so many like pumps that like are controlled by an app. And so then I'm thinking about the Wi-Fi or Bluetooth connection, like the EMF right there on your chest. So, and
Yeah.
if you're exclusively pumping or you're doing it every day, that's so much added EMF, which is an endocrine disruptor, but like it does so much else to disrupt your body and put cellular stress on you. And that's where
Yeah.
I was like, I think I'm gonna go the manual because I rarely want to do a bottle. So I'm like, just a little manual one is easy. Have you been seeing these EMF, like these like connected pumps?
The other thing I don't like about them is, or all of that, is that it's performance.
Mm-hmm.
There's an expectation that you have to get so many mils per kilo and fill up these bottles. That's not how breastfeeding works. So we really want to simulate breastfeeding and just express to the volume that they have in a bottle. And so the way you would do that is just know the feeling of your breast before and after breastfeeding and gently express to around about that volume. But this is the problem with mums, who are following a lot of these social media things. They just want to extract as much as possible, and they're
Mm-hmm.
creating all terrible sorts of sores and wounds on their body and trauma, bruising, and all these things. That's not how breastfeeding's supposed to be. Or
Yeah.
expressing. You're not a dairy cow.
Yeah.
But you're
I
right.
love
All
that.
the technology, I call it's technicalization, and it starts back in, your ultrasound, your early ultrasounds, your CTG monitoring, all the monitoring that we do to women. It's technicalization, and we've become,
Mm-hmm.
it's become normal in our world, and then we're measuring against graphs and performance measures. It's not how breastfeeding works. It's
Right.
intuitive, it's instinctive, it's something we do, not something we measure. And then if we're measuring it against breast milk against formula, well, literally everybody is going to come up subpar, because breast milk is not the same volume as formula. It's
Mm.
different between breasts, it's different between the time of day, boys, girls, summer, winter, depending where you are in the world, if the baby's sick or healthy, or how breast milk changes. There literally is no calculation. But formula is huge. It's a huge,
Mm-hmm.
huge volume, based on a calculation, because it's dead, it's inert, it's mineral based, it's poorly absorbed. So to
Yeah.
have minimal nutritional requirement, we need a large volume. It's totally different to breast milk. So if we're comparing the two, you're always going to think you're subpar, but actually, in fact, you're perfect.
I love that message. I think that's just an important message. Like, let's bring women back to intuition.
Mm-hmm.
And it's not about adding another thing to your plate. It's going back to basics.
Go
And
back to basics.
I
And it's
love
like
that.
test weighs. Every baby is being test weighed now, before a breastfeed, after a breastfeed. What does it tell us apart from absolutely nothing?
Yeah.
Because if we're using the math, the formula calculation, again, all of our babies won't have transferred enough milk.
Mm-hmm.
But in fact, they have. So the observed cues, like we were talking about before, Delaney, that are far more important, and watching the drawing and the swallowing and the observed cues of satisfaction, and watch the output, wheeze and poos, far more important than watching the scales. In fact, I've heard so many stories of women who have been, so test weighs are often determined because of insurance policies. So they say you have to do a test weight to prove the baby's feeding well, then you can get your Medicare rebate or whatever it is. So it's not actually a best practice, it's determined by insurance. So that's a really important thing to understand. But often I've heard stories of babies who have not transferred enough milk, been given a bottle of formula have been weighed again, and there's still been zero increase on the scales. So
Wow.
that's how accurate the scales are sometimes. So, it's one of those things where I would be asking a lot of questions, always with respect, of course, but I would be asking a lot of questions and not feel somebody else's pressure. At the end of the day, this is your baby. Don't be scared to advocate.
I love that so much. Yeah, I think a lot of women are scared to push back or ask questions because doctor always knows best, right? And
Well, more than that, women are being threatened with child safety if they don't do as
yeah,
they're told, and that's what
wow.
I'm seeing more and more.
Wow. That's crazy. The more I talk to people like you, the more I'm like, yeah, I'm so glad I'm doing this out of system. And like, even, her PCP is going to be a naturopath, probably my naturopath, actually, just things like that. People have been asking me, I'm like, no, like, I don't want her to be in this like systemized, medicalized, like technocratic environment. It's
They
not
have to
conducive.
stay safe.
Mm-hmm. Exactly. Exactly. Okay. So before we wrap up, do you have any final words of encouragement for the moms or moms to be listening to this episode?
I would say always trust your instincts, but if you can do one thing for yourself, it's prenatal breastfeeding education. Prepare. Jump on, have a look at the Thompson Method, have a look at what we offer. You'll be hugely surprised. We teach bipolar opposite to what is out there in free internet land, and you get what you pay for. Breastfeeding is taught typically in a regimented mathematical way. It's about lactation, it's about rules, it's about technique. There's so much more to that that's instinctive, that's going to set you up on the right foot. Dr. Robin's research is the highest quality in the world. It's peer reviewed. It was published in the best journals in the world. And so nobody else teaches what we teach. So it's not that it is really different. You're not going to see it anywhere else. And for 4 hours of pregnancy learning, you're going to set yourself up for an easy journey.
I love that. I'm sold. I'm like, I'm going to go join this for sure. Cause I've been following you guys for a while and learning so much of just the free content you put out there. I'm like, I want to take this to the next level and have a really successful journey. So I love to
Yeah.
ask all the experts, what's your wellness goal right now?
Oh, my wellness goal. Oh my goodness, I don't know. I survive every day.
That's fair.
I'm hugely busy with work and study, so I
Yeah.
work full time, study full time, and I own and manage a farm, and I've got 3 children and a husband. So I'm just I just get through every day at the moment. I always try and eat organic and be clean and do well. But at the moment, I'm just surviving through each day.
That's beautiful. Sometimes that's the goal. Is like, hey, how are we just going to take care of ourselves in, bite-sized ways and get through each day with grace? Where can
Exactly.
people connect with you and connect with the Thompson Method, like on social media or, to purchase your program?
Yeah. The best way is to jump onto the website, which is just the thompsonmethod.com. But we're all over social media, so you can find us anywhere. But just jump onto the website is probably the first starting point.
Phenomenal. Well, I know what I'll be doing tonight. I'm excited, especially heading into, about a week and a half left until my 3rd trimester. So now I'm like, okay, it's crunch time. I really want to soak up as much as I can and just be really prepared. So if you are preparing for a baby on the way, or even if you're already a mom and you just want to increase your knowledge, this is, such a great resource that's out there for you. I'm going to be using the money I was going to spend on my placenta on this. And I think that's where I'm at.
Yeah.
Well, you guys, I hope you love this episode. Make sure to give the Thompson Method a follow. They have been such a gold mine for me, finding in my own pregnancy journey, wellness journey. So I really recommend checking them out. Go to their website. Let's do the program together. And Rachel, thank you so much for joining today.
Thanks for having me, Delaney. It's been lovely to meet you.
And likewise, it's been so lovely. All right, guys, thanks so much for listening. I hope you have a wonderful rest of your day. Until next time, we will chat soon.